Think about the difference between breathing and solving a crossword puzzle. One happens automatically, the other is an acquired skill. That gap between instinct and acquired ability is where the process of learning occurs. The textbook establishes three formal academic foundations. Henry P. Smith describes it as the acquisition of new behavior resulting from experience. Crow and Crow frame it as acquiring habits, knowledge, and attitude. And Rod Plotnick defines it as a relatively permanent change in behavior brought about by experience. Across all three perspectives, three specific words repeat: change, experience, and permanent. For a behavior to be considered learned in an academic sense, it must be a lasting shift derived from direct experience. For nursing and psychology professionals, these definitions provide the baseline for observing human behavior. Before you can address how a patient adopts or resists a new health routine, you must first identify the mechanisms that allow that behavior to take root. The Nature and Characteristics section expands on how this process operates. It specifies learning is a continuous, universal process occurring from birth to death and is purposeful and goal-oriented. Specifically, it notes learning prepares an individual for adjustment and adaptation. In a clinical environment, this is the process a patient undergoes when they modify their daily life to manage a new diagnosis. However, we must distinguish learning from maturation. Physical changes, such as a child growing taller or a voice deepening, are biological progressions that happen passively. Because these are driven by growth rather than experience, they do not meet the academic definition of learning. The same applies to temporary shifts caused by fatigue, illness, or drugs. Since these behavioral changes are transient and chemically or physically induced, they are excluded from the category of learning. Consequently, true learning is categorized only as an active acquisition born from experience, not the passive passage of time or a temporary physical state. This diagram illustrates how learning is further categorized into 8 specific types. Understanding these distinctions helps identify the different ways humans process new information. Verbal learning relies on language and symbols to communicate information. Motor learning, by contrast, involves mastering physical movements and the use of equipment, such as driving or drawing. Returning to the text, conceptual learning is the mental process of forming a generalized idea about things or events. This differs from problem solving, which requires active reasoning and imagination. Serial learning is the memorization of a strict sequence, like the alphabet. Paired associate learning involves linking two independent items together, such as matching a word in one language to its equivalent in another. Bloom's domains often work simultaneously. For example, playing a game of chess requires the cognitive domain to understand the rules, the psychomotor domain to move the pieces, and the affective domain to maintain sportsmanship. These learning processes occur across 3 environments: informal settings like home, formal settings like a classroom, and non-formal settings like professional workshops. These categories are driven by established theories, including trial and error, insight, and classical or operant conditioning. By identifying which of these 8 categories a task falls into, you can better determine whether a patient needs physical practice, abstract explanation, or sequential memorization to successfully adopt a new clinical habit. Let's test these concepts with some active recall. Question 1. According to Crow and Crow, learning involves the acquisition of which 3 elements? The answer is habits, knowledge, and attitude. Question 2. Learning to physically operate a piece of medical equipment is an example of which type of learning? That is, motor learning. Final question. Does a change in behavior caused by a temporary illness count as learning? No, because it is a transient physical state. This summary covers the definitions, characteristics, and 8 types of learning we've discussed. You may want to screenshot this for your revision. These psychological foundations provide the lens through which you can assess how patients absorb and act on the clinical instructions you provide in a healthcare setting.